1.8 million Nevadans have a medical condition that places them at greater risk for COVID-19.
So who among all of them will get priority? Well, the state says the decision could be in the hands of your doctor. Who's up soon? The state's COVID-19 vaccine playbook says those 16 to 64 with underlying health conditions. That's more than 1.8 million Nevadans. The state's COVID-19 task force says Monday it's just not practical for them all to show up to mass vaccination sites and explain their health.
It's not incredibly supportive of working through underlying health conditions. So whether it be their own providers or some of our retail pharmacies.
The task force says they're working to get doses to local doctors and pharmacists and those who know you and your health. A technical bulletin helps Nevada doctors determine who's at greater risk. You have increased risk for severe COVID if you have cancer, COPD, heart conditions, pregnancy, or obesity. You may have an increased risk if you have asthma, hypertension, high blood pressure, dementia, or neurological conditions. The bulletin says if supplies are low, doctors can prioritize those with 2 or more conditions.
We'll follow whatever guidelines the state and the Southern Nevada Health District administer. UNLV and our CSN Henderson site, the NG sites, we feel very comfortable handling people with chronic conditions.
Dr. Michael Gardner, UNLV School of Medicine Vice Dean of Clinical Affairs, says UNLV's sites have plenty of vaccines available. They will take people with chronic conditions without extensive or invasive questioning.
That's not the way we approach patient care. There's a little bit of faith involved. I mean, in the 57,000 doses we've given, I'm not even sure 1% of people are trying to do something dishonest.
And state health officials say that some doctors' offices have requested the Johnson & Johnson vaccine for their patients because of easier storage.